Every year, millions of people are diagnosed with cancer all over the world. Now, in addition to the physical problems and emotional distress caused by cancer, the high cost of care are also a burden to patients, their families, and to the public. Now, by preventing cancer, the number of new cases of cancer is lowered, and hopefully this will reduce the burden of cancer and lower the number of deaths caused by the disease. Now, here with tips on how to prevent cancer, Dr. Susie Chen with the Cancer Center of Hawaii. Hello. Thanks for being back with us.
Thank you for having me.
Let's start with the big question. What is cancer?
Right. So cancer is your own body that is growing too much, meaning that normally our cells know when to stop growing. Cancer is when those cells cannot stop growing and they grow out of control in one area, and the other problem is that it can break little pieces off and go grow in other parts of the body and cause problems there.
It's so funny, you know, we hear about cancer all the time, and I don't think I've ever asked what is cancer, and the way that you've explained it, I understand now. You know, you hear about tumors, you hear about cancer, but thank you for explaining that in a way that I think most people can understand. So what causes cancer?
So cancer is when those cells, like I was saying, lose their ability to stop growing. So there can be different agents that actually cause those cells to lose that ability, and it takes actually multiple of those actual inciting agents, so multiple of those causes to actually occur. Now, some people can already be born with a hereditary, meaning something in their genes that cause them to be more prone, so they're already at a level that makes them more prone, and then they can have just a couple little things that push them over the edge, so push their cells over the edge to start growing too much.
Okay, and so I guess if it's genetic, if it's hereditary, there's probably not much we can do about that.
Well, there still are things. So just because you're genetically prone to, say, a cancer does not mean that you are going to get it 100%. So definitely there are things that all people can do that actually can decrease their risk of cancer.
Okay, and what are those things?
So mainly the common thing is just to have a healthy, happy lifestyle. So we generally say to eat a good diet that's low in processed foods, red meats, low in fats and sugars, as well as to exercise. Exercise is very important. These two combined can help people maintain a very good weight level, which can actually play into someone's risk of cancer as well as decrease their stress levels. We know that when people are stressed, it actually decreases their immune system. And our immune system is one of the ways our body detects if a cancer is starting to grow, and it actually tries to take care of it before it actually becomes a problem.
Okay, so living a healthy lifestyle with a good nutritious diet. And then I also have here on my notes sun exposure and tobacco.
Yeah, so again, going back to that healthy, happy lifestyle. So alcohol and tobacco have been associated with an increased risk for cancer, and obviously we know tobacco is a very big deal, and it extends beyond just, say, smoking cigarettes to smokeless tobacco, as well as now that the e-cigarettes have become so much more popular, we really don't know what the long-term effects of those actually are. So generally, we say just stay away from most tobacco products because we're not sure what's going to happen. They're so new. The other thing is sun exposure. So the most common cancer in the world is still skin cancer. So it's very important to use sunscreen to stay out of the sun when it's at its highest and brightest. The Hawaiian sun can be quite unforgiving, as well as to use barrier protection. That's one of the best ways, because a lot of times when we're out in the sun doing things, we forget to reapply our sunscreen. If you have on barrier protection, it's something that you don't even really have to worry about.
Those are all very good advice. I know there's really no excuse for that because we now know the harmful effects of tobacco and sun exposure, so we can't say we didn't know, right? I know that for my own children, I really try and stress that at an early age. Well, thank you very, very much.
Thank you for having me.
It's all very educational.
Thank you.